Welcome to the MEDSIS overview. Let's explore. Behind this login screen is the new Medical Electronic Disease Surveillance Intelligence System, or as we know it, MEDSIS. But before we dig in, let's discuss our course objectives. This module introduces the MEDSIS platform, its role in the case lifecycle, and basic system navigation. So what is MEDSIS? It's a centralized electronic disease surveillance, tracking, and reporting platform helping public health professionals collect and manage data on conditions of public health importance for timely responses and interventions. Why is it important? MEDSIS enables health authorities to respond properly, identify outbreaks quickly, and coordinate public responses. Centralized data simplifies trend monitoring, communications with health organizations, communications and data sharing between public health agencies, and supports preventative measures. MEDSIS is built around persons and the cases associated with them. MEDSIS tracks both person and case data, but will focus on a typical case life cycle to understand its role. A case can enter MEDSIS multiple ways like manual entry, electronic lab reporting, or batch upload. Once created, we can edit and update the case information as needed. This case creation often initiates an investigation within its local public health jurisdiction, during which the case is actively monitored and updated. Once the investigation concludes, the case progresses to state review. The state then reviews the case, ensures relevant case data is submitted to the CDC, and will close it once all steps are completed. Even after closure, the case data is still analyzed and logged within MEDSIS. Next, let's dive into MEDSIS and explore key elements, including the cases, secure messaging, home, profile, notifications, and resources page. For this demonstration, we'll log in as an ADHS public health worker to highlight key functionality. Access will depend on our user setup, which is covered in the MEDSIS User Permissions module. This overview will provide insight into the platform's overall capabilities. The home page includes announcements and a top navigation bar featuring options like cases, exports, resources, admin, secure messaging, and a profile icon. This navigation bar is tailored to the user type. Note that the export and admin options are not accessible to all users. Each of these features will be detailed in upcoming modules. Clicking on the Cases tab takes us to the Cases page, which displays all the cases we can access. Here, we can search for cases using filter and sorting options, merge records, and perform batch actions like uploading and sharing cases, depending on our user permissions. This page is detailed in the Case Foundation modules. For now, let's focus on creating a case. Clicking the Create Case button takes us to the first step, selecting the morbidity, then the reporting facility, and, as a public health worker, the reporter. Next, click Get Started. The case form displays to enter available case information. Once all details are entered, the case can be saved and reported to public health. The case creation modules explain this in more detail. Next, we'll discuss the Resources tab on the top navigation bar. Clicking on the Resources tab opens a page dedicated to essential tools and materials, making it easy to find and utilize helpful content. The Resources tab aims to enhance our experience by offering a centralized hub for us to easily access helpful MEDSIS guides, outlines, and other essential documentation. Continuing along the top navigation bar, we encounter two more icons, the first representing secure messaging. The secure messaging page enables efficient and secure communication within MEDSIS, allowing us to send and receive critical updates, reminders, inquiries, and notifications. It also provides tools to search for specific messages, manage the inbox, create and view distribution lists, and access special case notifications. The last icon on the navigation bar we will cover is the profile icon, which is personalized with our initials. Clicking the profile icon opens a drop-down menu with options specific to our user setup. While the drop-down menu is tailored to our user setup, we all can access User Profile and Languages. Let's review each available option to understand what we might have access to. On the user profile page, our MEDSIS username is displayed beneath our name. This username cannot be edited. Below that, we see editable fields for our first and last names. Changes here will not affect our username. Next, we find a field for our email address, which is used to receive MEDSIS notifications. There is also an optional field to add our phone number, completing the profile setup. Selecting the Notifications option from the Profile dropdown, available only to public health workers, opens the Notification Preferences page. With Access, this page allows us to customize how we receive updates. Preferences can be customized based on morbidity, jurisdiction, where applicable, and the condition of the case, such as newly created or edited. Additionally, a toggle switch provides visibility to all the notifications to which we are currently subscribed. Finally, selecting the Language option from the drop-down menu allows us to set language preferences to English or Spanish, eliminating the need to switch between applications. With these customization options reviewed, let's summarize what we've covered. This course provided an overview of MEDSIS, explained its role in the case lifecycle, and introduced foundational system navigation. Now, let's take a look at the upcoming MEDSIS learning sections, providing a glimpse into the next steps in our training journey. After exploring some key features of MEDSIS, we hope you feel confident navigating this powerful platform and are looking forward to future training sessions.